This section is on Code Blue Ministry. So I know the last segment there we talked a lot about medical. You hardly even thought you were in a chaplaincy training, right? Now we're going to get into chaplaincy. Now we're going to make that part practical, okay? We're going to use that part of understanding advanced directives and end-of-life care and use that as a family member, as a minister, as a chaplain, however, or even for your own self. The scenario I'm going to put you into is that let's pretend there is a code blue. Let's pretend, and let's define that first. A code blue is a cardio-pulmonary resuscitation. Could be caused by the heart, could be caused by the lung. For some reason the patient stopped breathing or heart stopped beating, and they called a code blue overhead. And they may say the room number. You might be in the hospital when you hear that room number. If you're a chaplain, you're in the hospital and you hear room 313, go there and visit with C. Now remember, you're not going to be helping the patient in this picture because they're going to be cared for by all the team. But you're going to help the family. The question is there any family here? Anybody can help. Of course, you're going to be praying for the nurses and all them too, but you're going to be kind of seeing if there's family member, but you won't be standing by the bed. You won't be holding the patient's hand while they're doing the paddles. You'll get shocked along with them, you know. So you're going to be there for the family, okay? There's not even be enough room for you in the room. There's going to be a physician there, a nurse there, several nurses, respiratory therapy, and then a lot of gawkers, and then there's no room for you. And then there's machines coming in out of the hallway. So maybe the very first time you've seen a code blue, hover, not close, but hover and kind of watch that because you might be curious, but just stay out of the way so they can get in and out of the room. But then at some point you may be saying, I'm the hospital chaplain, Larry, just wonder, is their family here? And they're so busy they didn't even hear you. Another moment you come back in, I'm the hospital chaplain, Larry, is there any family here? Anybody know? Nobody knows because half of them aren't even the patient's nurse. Okay? They're just those that have come for the code. So finally you get the attention of the patient's nurse to go, yeah, they're down the hallway. Or no, we just called them. Or no, we need to call them. You know, but they are taking care of the patient. Don't interrupt that. That's the main thing to get that patient back alive. And when you get a chance to be able to ask them what's going on. There's another term you might hear in hospitals. I don't know if they use it here in this one. Rapid response team. That is a kind of a new code. It used to be all called code blue. Well, it happened that a few nurses were being shamed. A nurse couldn't feel a pulse, didn't notice that they were breathing, and they called a code blue, and another nurse came in and found the pulse, or found them breathing. And it was kind of like, you silly thing, you. Well, so now forget who's silly. Forget if it's a real code or not. Let's call a rapid response when you see something not right. And let's get somebody evaluating this patient. And if they're doing fine, good, they're doing fine. Nobody's shamed. You didn't call a code blue by mistake. But call a rapid response if you see something going on. The team comes in and goes, it is a code blue. It is a stroke. It is what, you know, or no, it's not, but glad you called. So that will be called when someone spots something that's not quite right. The team comes in and checks that out. Another term you might hear is stroke alert. They may or may not call it that at this hospital. If they do, then someone is seeing signs of a stroke. All employees have to take a class on stroke alert to spot stroke, even non-medical people. So that if I see something that looks like a stroke, I call 211 and it alerts the operator, and she calls a code on that, so the team comes. It may be even a family member in the hallway, okay? But something's not right about this patient to get a team coming in to check that out. What to do? I don't know if you're task-oriented like me, but I like doing something. I don't like sitting there and smiling. I'm not comfortable with silence. So I'm coming to help the family, and they're not talking. So do I talk?
Nope.
Or, you need some water? You need some water? You need some coffee? You need a chair? You need a phone? Let me go get some information. Can you just be there? Now, folks, I'm ADHD, I'm hyperactive, I'm task-oriented personality. This ain't easy for me. Right? But you learn. So what do we learn to do as chaplains? We talked about it in the last seminar, the ministry of presence. The main thing we do as chaplains is just show up. Remember we learned the effectiveness of prayer, how effective prayer was for the prayer group who didn't even go visit the patient, they just prayed and they got better. That wasn't even the ministry of presence. That was the ministry of prayer.
Yeah.
And now what if you pray and show up? What if you pray and show up and then do and say the right thing? Wow. What could happen in our ministry? Prayer's great, showing up's great, and then acting appropriate is wonderful. So we're going to talk about what we do in chaplaincy ministry. Let's put you in a scenario as if you're at home, you're a volunteer chaplain, and you're on call that day. You're not on call on Sunday, but you're on call on Monday, and here it is Monday, and you're on call. The cell phone rings, okay? Let's put you into that scenario. The nurse, Alice, calls you and says, there is a code blue in progress for Mr. Jones in room 301. His wife and children are in the waiting room, and she hangs up the phone because she's done her duty. She's called a chaplain. Now let's see how that came about. The family was in the room when the patient coded, and they shooed the family out of the room and started the code. Or the family wasn't in the room, there's nobody, just a nurse walked in and sees the patient not breathing, and they call a code. About 15 minutes into the code, maybe 30 minutes into the code, one nurse goes, don't we have chaplains? Yes, we do. Do you know how to get a hold of them? I guess we call the operator. Someone, not the nurse, bedside nurse, not even the nursing supervisor who's charting everything's going on in the code, but somebody's free. Hey, Alice, go call the operator to call a chaplain. The operator looks down this list of all the chaplains we have of cell numbers and finds out that your name is on for that day, and they give you a call. And you're not at the hospital. You're at home, and you get the picture here of getting this call. Alice only tells you his name is Mr. Jones. You don't know his first name. You know he is in room 301. So you know, okay, is that in our hospital, 3rd floor? Got that. And the family is in the waiting room. Click.
Which way?
Okay, what would you wish to know? Now, first of all, here's the problem. Alice isn't going to know the answer. Alice isn't the patient's nurse. Alice may have never met this patient or seen this patient walk in the room. But she's the one that's calling the operator, and the operator's calling you. Okay? And you're going, but, and the operator, I don't know. I don't know your answers. So you're driving to the hospital, getting dressed, driving to the hospital, wondering. What are you wondering? What would you like to know as you're driving to this hospital? What would you like to know about this patient?
Patient's first name.
What's his name? I'd like to, what if there are 2 Mr. Jones? I get the wrong one. You know, that's possible. Smiths and Jones, a lot of those. But I'd like to know his first name. What else would you like to know about this patient?
What's going on?
What's going on? Was this an elderly patient or young patient? Were they expecting it? Did it baffle all the nurses that this Mr. Jones died? Or, yeah, sure, we all knew that he was going to die soon. Okay? Some question. What else would you want to know? Coming to minister to this Mr. Jones. What waiting room? Okay.
Well, what religion?
What religion? Was he a man of faith? Does he have a church? Has the church been called? Is the pastor on his way? Is the pastor out of town? Is the pastor on vacation? Is the pastor sick? Those kind of questions about this. What else? Okay, you're putting your clothes on, you're getting in your car, and you're driving to the hospital, and you're wondering, and all you got is this information, that there was a code blue in progress, Mr. Jones 301, wife and children in the waiting room, and you're on your way. What could you do on the way? Pray. Pray for whom?
Pray for Mr. Jones and his family.
Pray for Mr. Jones. Who else? The family. Whom else?
The
Nurses. Doctors. Respiratory therapists. They're running crazy. They're saving someone's life. And if you've ever watched the code, they're a little frantic. Okay? So they've got to do their job. They want to save a life. Who else would you pray for?
Yourself.
Yourself. Okay. So there's a lot of things you can be doing on the way while putting on your clothes and getting in your car and on your way. And I don't know how far you live away, but if you were making your way in, but you might be getting this from your cell phone and you're at Walmart or church or out at the beach or in your swimming clothes. And so we'll talk about some what-ifs, things that might happen. What if you can't come in? I know you're the on-call chaplain for Monday, but you can't come in, and there are a million reasons why you can't come in. So we're going to supply you with other cell numbers of other chaplains, but maybe when you get that operator calling, you go, I'm sorry, I know I'm on call today, but I can't come in. But sometimes this comes to me later. I go, sure, I'll be there, and I go, my wife took the car. I don't even have a car. Or, I'm really sick, and I shouldn't go in. I said yes, but truth is, I can't go in. So I may have a list of other cell numbers of other chaplains, and I go, can you come in? Can you come in? I'm not able to for whatever reason. And understanding, we're volunteers, okay? We're not getting paid to do this, but you've signed up for a certain day, but there's certain things that come up that you just can't come in yourself. So what if you're improperly dressed? What if I'm at Walmart and I'm in shorts, or I'm at the beach and I'm in shorts or whatever, but you know, I don't have the proper attire. Number one, if Monday is my day and this is Monday and I might get called today, I keep a little ditty bag of my hospital volunteer clothes in there. And my badge is there. Because no nurse, no doctor, no employee can walk in this hospital and do their duty without their badge. That's a breaking of HIPAA law. Patients have to be able to identify who you are. And if you come in here, but I was called to help, you go home and you go get your badge. Don't you have a temporary one? No. You go get your badge. Is that a baby boy? Oh, I thought that was your baby boy.
Yeah.
Some hospitals do that. You know.
Good humor, man.
Okay. So you have to have your badge with you. I would keep if I'm on call and I go about my life, I'm going to keep my badge with me just in case, and I'm going to keep some clothes just in case, so that I can go kayaking and I can go to the beach, whatever. Yeah.
Can't remember what predicament I was in, but I was here and I didn't have my blue outfit on, so I went to the volunteer room and there was an extra one in there.
Okay.
You know, so
Yeah.
I mean, a lot of times volunteer rooms in different hospitals, I'm not sure about that, but I know this one,
Yeah,
we had
have an extra.
things.
But they wouldn't have an extra badge with your name on it.
No, I have my badge because I
Yeah.
was here.
Oh, you have your badge.
You know,
Yeah.
yes.
Good. So just kind of keep that available. What if you are sick? If I'm infectious, I shouldn't be here.
Yeah.
I know the family's hurting and they're grieving and they need somebody, but they don't need a sick person here. So we need to be ethical about that I'm not going to give them something. And there are times when just beyond your ability, you may be the most healthy person on the planet. For whatever reason, your headache is so bad, your stomach ache is so bad, you can't come in. And you're just beyond for that.
You know what you should do in that
What's
case?
that?
Is you should call the hospital or call somebody else on
Yeah.
the list and say, I'm sorry, I'm sick today.
Right.
Could you please take my place?
Right. We have that backup. But there's times we have to be honest. I've even been called in the middle of the night, been sitting with a wife or her husband's bed. And I'm healthy as a horse. I rarely get sick. For whatever reason, I got so nauseous, I had to leave. I said, ma'am, I don't know what's wrong with me, but I need to go. And I barely got it out of my mouth to the nurse, I need to go, I can't, you know, and gone. And there are times like that when you got to take care of yourself. There's a whole seminar I'm going to do on self-care. You know, just taking care of you so that then one day you can take care of somebody else. I know once in my life I didn't learn that. I had to learn that the hard way. Just taking care of yourself so you can be caring for others. So if you may not be able to come in, what if no chaplain come in? What if you have 25, 30 chaplains and you call them all and nobody can come in? Well, we're volunteers. We did our best. And God's in control. And we just couldn't come in. There are times like that. So I do a backup thing. I train all hospital employees. That's another part. Not in this seminar. I will be doing another seminar for all hospital employees for everybody to be spiritual. Not invite them to your church, not evangelize, but meet patient needs. So I train case managers and nurses and all that, you know, if you see somebody grieving, can you go down the hallway? Can you get them a cup of water? Can you get them a chair? Can you offer them a cell phone? Just about everybody has cell phones now, can get a hold of somebody. Can you help them in some way? And then as I left a family member one day, I was giving them a hug, and one male nurse said to me, I wish I could do that. And I go, well, let's practice it. Can you do that? And he goes, no, I can't. I go, okay, let's do it again. And he goes, I know what you mean, but that's hard. Well, there may be some staff members that are quite comfortable in giving a hug. Okay? Now, say if you're comfortable giving a hug, give a hug. And if you're comfortable with offering prayer as a nurse or as a person who mops the floors or as an IV tech or whatever you do, if you're comfortable, pray with them. It's okay. And I've had several employees like, they said, okay, I didn't know that was all right. Yes, if they want it. If they don't want it, don't do it. But if they want it, that's the litmus test. If they want it, then we can do that.
You need to ask them. Always ask them, do
That's
you
simple.
want a hug?
Yeah.
Do not walk up and hug somebody.
Right.
That's assault.
Yeah. And as I taught in the last session, what did we say about reading?
Yeah.
You ought to be able to read that or assume, you know, and if you can ask that question. So if we're reading they're stiff kind of people, don't hug them, you know.
Always ask them.
So in that way we can help them. But several employees can do that. Even if we're not there, I'm going to be training other employees to do that part. Okay, you've arrived at the nurse's station. You've got the call. You've come in. You're at the nurse's station. And that was 301, so I don't know how you have 3 floors in this hospital. So that might be the 3rd floor nurse's station. Okay, I guess it's supposed to go there. But what might happen? Let's see, I told you that 15 to 30 minutes into that, one nurse goes, do we have chaplains? And someone said, yes. How do we get a hold of them? Operator, I guess. The operator then finally gets off the phone with another and finally gives you a call. You finally get the call, you get dressed, and you make your way here. This may be an hour since the code has started. So some questions may come into your mind. Some of the same question we had before. What's his name? Is the family where? But you said 301, that's when it started. Many times after they get into the code, they take the patient to ICU to take care of them so that those nurses who understand the monitors and understand those kind of IVs and understand that kind of procedure can take care of that patient better. So he may not be on 3rd floor anymore. But I'm still going to go to 3rd floor, show up and go, hi, I'm Chaplain Larry. Alice called me. Is patient Mr. Jones still in room 301? No, he's in ICU now. So then you go down there, or he might still be there, but then you ask that. I could, on the way, carry some numbers in my pocket of all the nurses stationed on the way, call 301 going, I'm 10 minutes away, I'm just wondering, is Mr. Jones and the family still on 3rd floor? No, he's already in ICU. Then I go there. They just save me 5 minutes of getting to the right place, right time. This kind of this preparedness, if we kind of get the feel of the hospital, kind of know how things act and react so that we can be a little more responsive to that. Same kind of questions that we had before. Maybe what is his condition now? We might say very politely and tactfully to the nurse, I'm Chaplain Larry, coming up, just want to know, how's Mr. Jones now? I don't really need to know technical medical information, just need to know, is he stable? Did they resuscitate him? Is he still with us? Because here's the problem. I've had some of my volunteer chaplains walk into a situation like this. The case manager called him, hey, come in here in the room to help the family. Okay? The patient's not doing well. So he comes into the room a few minutes later after he comes up to the floor, walks into the room with the case manager, grabs the hands of the wife, the spouse, and goes, let's pray for him to get better. And she goes, well, weren't you told he's already dead? And he looks at the case manager like, well, why didn't you tell me? And I said to him, the volunteer, why didn't you ask? Yeah, maybe she should have told you. But on the way, can you give me a little bit of update? What's going on? Okay? So kind of like we get in the fog sometimes, and they go, I don't know if I should tell you you're only a volunteer. All I need to know is how to pray and how to approach the family. See the difference? I don't need to know if he has cancer. I don't need to know if he has AIDS. I don't need to know if the husband and wife have been squabbling. I just need to know, is the patient, what condition they're in now, so that I can do my ministry. Okay? So we get into these pickles sometimes because we don't ask the right questions so we can get ready. Here's a big question that I ask. Has the family had a medical update? If I were to come in and do my ministry, the first ministry I would think I would want to do would be prayer. I would want to see how they're doing and do prayer. I don't know how to pray until I've had an update. But the family doesn't know how to accept me as a minister until they know the condition of the patient. Here's what happens many times in codes. The patient coded a few minutes ago. They resuscitated him. They got a pulse. Then they lost a pulse. Then they got a pulse. Then they got a heartbeat, and they lost a heartbeat. He was breathing, then he wasn't breathing. So when is the nurse going to go down? Well, he is, he isn't. He is, he isn't. Okay? So they go, well, let's just wait. Let's just wait till it kind of gets stable, and then we'll go give a report. So 30, 45 minutes, an hour into that, the families are going, what's going on? We're not getting any information. So if you were to walk in during that questioning moment, what's going on? They don't want to hear your prayer, even though they're the most spiritual people on the planet. They want to know, how's he doing? Is he with us? And so you prepare that by just asking the nurse on the way, okay, go down and see the family in the room. Well, wait a minute. How's the patient doing? Have they received a medical update? I think they did. No. Did they receive a medical update? Have they been updated? Because they're not going to be ready for me until they've got a medical update. It's almost like the feeding the 5,000. They're not ready to hear Jesus serve until they've had their stomachs fed. Okay? There's certain kind of preparation for ministry in that. So it's like I need to get someone, I might say, which one's going with me? The doctor and nurse, somebody going with me to give a medical update. They come in the room first. I'm behind them. And they give a medical update. I don't have a badge on right now, but I might even do this trick. I flip my name over so the title Chaplain's not seen yet. What are they going to think the first thing they see Chaplain? He's dead! Okay? So I've had many times nurses go see the family over there. And I go, flip that. Hi, I'm Larry. I'm here with the hospital. Wanted to be with you for a moment. You're going to get a medical update in a few minutes. Just want to see what I can do for you. Oh, I didn't notice my badge was flipped over. I'm the chaplain. Now, how does that pave the way better than, oh no, I've had them scream running out of the room. Oh no, he's dead, he's dead.
We tell ours not to go into the emergency room.
Oh.
Unless, in other words, don't hang around the emergency room.
Oh.
Don't go in, because if a patient comes in out of an
Yeah.
ambulance, family riding with them,
Yeah.
and they see that chaplain,
Yeah.
the worst.
I wouldn't say don't go in there.
Well, no, we go.
Yeah.
Code blues and
But
stuff
just,
like that, we
you know,
go
be
in.
careful how you
and
present that.
approach the
Yeah.
nurse first, the head nurse, and find out what the
Yeah.
situation is before.
But sometimes the first words are, I come here to be with the family. The nurse called me. Here's why I'm here. It's not because he's dead or he's doing that poorly. That's why they called you. I come here just to be with the family, just wondering how I can help you. And then this
Little comfort.
comfort, yeah.
Yep.
So then they go, oh. Especially, you know, if I were a priest, they're always thinking last rites. Well, they're still thinking that even with Protestant chaplains, you must be here for last rites. You must be here because it's that bad. So I may tell them very quickly why I'm there, so that kind of take away that pressure. Then you're down in the room meeting with the family. This meeting could be no people, no family, to 40 or 50 people. You live in a community where people have grown up here for several generations. Everybody has cell phones. And when Grandpa comes into the ER, the whole family stops work and comes to the ER. And so then it's maybe more of crowd control than sharing with them my testimony. It's more of, okay, you sit here and you sit there and I get some of the water. And then you're maybe trying to assess this. The patient says he's Baptist and the wife says she's Pentecostal and the daughter's Catholic and the son's Jewish, and, you know, what do I do? Okay, again, I want to do something. I want to be special. And you may be kind of putting on different religious hats, even for those who aren't religious. I don't need prayer. Okay, but you might need a cup of water, might need a hug, you might need a chair, okay? So it's different ways we can minister, and it won't be all the same way with every family or even a blended family of different faiths. So meeting with them, again, what do? You've got the medical update. Then it's time for you to introduce yourself, tell them why you're there. Then meeting their basic needs, whether that be a chair, a phone, coffee, or water. If I'm working with family members and I've been there for quite some time, then maybe I've been called in, and let's say it's going through a meal hour, breakfast, lunch, or dinner. And I'm looking at someone and I go, I don't say, it looks like you've got dry lips, but I'm looking for them. But I may just say, I'm going to go down the cafeteria and I'm going to get some water. If I ask them, would you like some water? What do you mean? You think I'm going to drink at a time like this? And they aren't thirsty because that's the way the body does. It doesn't feel thirst during shock, okay? It doesn't feel hunger. So I don't ask, are you hungry now? What, are you kidding me? You think we're going to go down the cafeteria and have a meal? But I have simply gone, I'm going to be back in 3 minutes, and I bring back some water and coffee, and some extra sugar, extra cream, or however way they like it, sweet and low, whatever, a tray of stuff. Go down to the cafeteria and go, I'm a volunteer chaplain here. I'm just getting some coffee and things for a family that I'm ministering with. And you're taking care of their needs. And you come in, but if you ask them, oh, what, are you kidding me? But they see a cup of water, they see a cup of coffee. Oh, thank you. That's the best cup of coffee I've had. Or I've been with family with a long time, and it's going through a meal hour, and I may ask a family member, do you normally take medicines when you get up in the morning? Yeah, I do. Do you have them with you? Yeah, I do. I'm going to go get some water, and I'll be back. And you probably need to take some food with that, don't you? Well, do you like muffins or bananas best? And then I come back and they take their medicine, because they say, we don't need 2 patients here. And when this guy comes home, you're going to be taking care of him, right? And you need to keep up your health. So that, yeah, you're right. I need to take care of myself. Get them centered on them. I've even seen them over a mealtime where they must be hungry and they just don't want to leave. They're waiting for an update. And if the doctor were to come in while they're gone, they'd feel so terrible that they weren't there to hear the update. So I go, I'm going to be back in a few minutes, and I'll get some things for us. And I go down to the cafeteria. I'm a volunteer chaplain. I need 5 different meals, sandwiches, whatever, and I'm going to bring them to some families here in the room. And I take them down, and they just say, oh, thank you. I can't believe it. You know, just if you had asked them, they would have said, no, what, are you kidding me? You know, well, you're hungry, chaplain? I guess, you know. But so we just kind of anticipate needs, kind of look for something that they might not mention on their own. Then some questions I might be gathering around them, asking them about Mr. Jones' faith. If I haven't heard yet, if they've already told me the Baptist pastor's coming, I know a little bit about them. If I know the priest is already coming, I know a little bit about them. But if I don't know that, I might say, tell me about his faith. What faith did he grow up in? Did he attend church? Was he a believer? Did he pray? I mean, you're staging those questions as you see they're ready for that. And you may find out that, yeah, he was one thing and we're another thing. Does he attend worship? Has the minister been called? So in this time, when you get done with the seminar today, you're going to know a whole lot of stuff your local pastor doesn't know. But that local pastor is going to come in and stand beside those people. They're called, and you're going to give that pastor the prominent position to do the prayers, to do the anointing, to do the baptism, to do the Lord's Supper, whatever. That's their place, okay? Because that's their parishioner, their church member. But that doesn't mean I run away, because I know some things now in this class that I'm here with the hospital. Just like a family member may come in who has a nurse as a daughter. Well, the nurse, they'd say, oh, you got a nurse? Okay. No, we work alongside. You've got your smarts, but this is my place, okay? So you know your role. But remember what we did about reading the room? Have you ever read the room when you weren't wanted? Mm-hmm. And you don't go, well, I guess I'm not wanted here. You just read the room you're not wanted, and you slip out. But then you may say, but as a hospital personnel, I have something I need to do, and you still may slip in because that's what you need to do. You understand the role? But you don't push it. So you give that pastor a place. But that pastor may say, Chaplain Larry, I know you've been here with my family all week. Will you lead us in prayer? Okay. You know, that happens. Or we both might pray, or I might pray a prayer, and then 2 minutes later the pastor comes in. I go, here, please pray. Okay? But it's your people. I know we've already prayed, but pastor, pray. Okay? Understand this working together with the team. Understanding your role, understanding your position, but understanding their position, so you're not taking that away. Now, I've scared you to death. The very fact that you're going to get a page one day and you're going to be thrown into this might scare you. Realize that I didn't give you every possible scenario may happen. I've just scratched the surface. But who do you have with you that's going to help you? God, the Lord, the Holy Spirit.
Is that it?
Now, with that package, you're good. Now, remember, Jesus sent out the disciples 2 by 2, and they didn't go to seminary. They didn't have a seminar. They just were sent out. And they came back, we can't do this, we can't do that, you know. Well, understand you're going to have the Spirit of God with you. But with this a little bit of training, it may help you understand some of the things that you might get into to prepare you for that. Okay? Let's take another 15-minute break, and then we will come back and do the last part of the seminar.